Now, let's turn to the psychological treatments for ADHD and look at those. Excuse me. Why do we want to do psychological treatments? If the drugs are so great and they're producing all of these benefits across all these domains and most people can take them without problems, then why don't we just do that? And indeed, that's possible. I mean, some children don't need any other treatment besides medicine, though in my experience, that's probably only about 1 in 5 ADHD children. The rest are going to need something else besides the medication, and for a variety of reasons, not the least of which is that as children grow up, we find that their likelihood of staying on medication drops sharply, and they don't adhere or comply with the medication any longer. And this can happen even within the first year. Often the reason for this is, at least in our country, the drugs are expensive and families don't want to pay for them anymore, or the family finds that the side effects are just too annoying, or the child doesn't like them and doesn't want to stay on them. So even though they're getting benefits, particularly at school, at home they're seeing mainly the side effects, and so they stop the medicine. Another reason, however, is that as children grow up and become teenagers, they want more of a say or influence in what happens to them. And so they're not blindly willing to simply take medication because you tell them to. You have to convince them to take it, they have to be persuaded, and they have to be motivated to take it. And a lot of children with ADHD, when they reach adolescence, aren't. They simply don't want to do that. So they're able to stop the medicine. Even if the parents want them to take the medicine, they can avoid it. And so that's another reason we see that. So, that's why clinicians often have to sit down and talk with the family, talk with the children, meet with them periodically in order to address these concerns that are leading to medication cessation. Another reason we use psychological treatments is that by combining them with medication, as I've said, we get the most ideal, the most optimal treatment response. We get more effectiveness, and often it means we have to use less of each kind of treatment when we combine them. So that's good news. We also need psychological treatments for the times of the day when parents and teachers have to manage a child with ADHD and the medication has worn off, or the child simply isn't taking the medication. And so we have to prepare these other caregivers for what to do, and those are the psychological treatments. ADHD children also are likely to have another coexisting disorder. About 80% of them, in fact, have at least another disorder. And many times the medication can't treat that disorder, like a learning disability or major depression or an anxiety disorder. The ADHD medicines don't help those disorders very much, if at all. So if a child has one of these coexisting disorders, we're still going to have to do other treatments, usually educational or psychological ones, to address the learning problem, the anxiety, or the depression. So comorbidity or a coexisting disorder can lead to needing psychological remedies for that. As I've said, combining psychological treatment with medicine can result in lower doses. That's a good thing, and less expense for the medication. There are certain subgroups of people with ADHD and their families where we are going to have to do additional psychological treatment. Let's suppose there's a lot of problems in the family. Maybe the parents have a psychiatric disorder or ADHD specifically. Maybe the family's not well educated and therefore needs a lot more time and attention from the physician or the professional. Then we're going to need to spend more time and more psychological treatment with them. Finally, research shows clearly that parents and teachers don't like us to simply give medication and do nothing else. They find that the treatments we offer are more acceptable if the medication is combined with doing other things to help that child. And that's important because if parents don't accept what we're recommending, then they won't do it. And so we need to address that acceptability. And one way to do that is by doing some additional psychological assistance for the child and the family. So let's take a look at these psychological treatments. Now, one I've already talked about is educating parents and teachers about ADHD so that they better understand it. That was step one, or the first component of our treatment package. The second thing we do is to teach parents very specific strategies around child behavior management. how to give commands better, how to structure tasks differently so they're more suitable to this child, how to use rewards and other positive consequences, as well as approval and praise to increase positive behavior and compliance and task completion, and then, if necessary, how to use penalties and punishments quickly and effectively for the child with ADHD. So these parent training programs are numerous. I'll come back and show you some of them shortly, but they're quite good. They mostly help lower parent-child conflict. They're not so good at lowering traditional formal ADHD symptoms because it makes sense. ADHD doesn't arise from bad parenting, and therefore improving parenting is not going to change ADHD very much. But it does improve compliance. It does reduce stress and conflict. It does improve oppositional defiant behavior. And since most ADHD children do develop oppositional and defiant behavior, then most parents are going to need a parent training program to help them learn more systematic, more effective ways of dealing with their child to make their child more successful and effective. Please notice that parent training works best for young children below 11 years of age, where we find that 65 to 75% of families tell us that there is a noticeable improvement in their child, in their family, in themselves as parents from using these behavior management techniques. However, by the time we get to adolescence, only about 25 to 35% of teenagers and their families report improvement in their levels of conflict and oppositional behavior by that age. And that makes sense because as children grow older, as they become teenagers, they're spending more and more time away from home, a lot less time with their parents. There's a lot less opportunity for parents to influence the teenager. Also, psychologically, the teenager is separating from their parents' influence, becoming more independent, wanting more of a say in what happens to them, and that will lower the likelihood that the parents can have some impact on that teen. And then, of course, the teen is coming under the influence of the peer group, which increases in its influence over teenagers. So for all of those reasons, these parent training programs don't work quite so well. We will offer them to families if they want them, but with the understanding that the majority won't necessarily benefit from them. We have to do other things, like work with the school, like pay attention to the peer group, or add medication in order to help that teen deal with behavior away from home. Now, another thing that is very evidence-based is doing behavior management in school. And I have an entire lecture as well as my book, Managing ADHD in School, that goes through 80 to 100 strategies for working with children within the school system to improve their success, reduce their problem behavior, make them more effective at meeting the demands of school. So lots of information out there on school behavior modification and behavior management techniques as well. But here again, as with parent training and other psychological treatments, they only work for the person who uses them, and they only work where they're employed. So if a teacher is working with a child in school using these methods and other teachers are not, those other teachers will not see any long-term or any benefit from what that one teacher is doing. They're going to have to get on board to do these strategies when they have the child in their classroom if they expect to see the benefits from the treatment. And the same is true of parent training. If only one parent is using the methods, the other parent is not likely to see much benefit from the behavior management training. So we need to make sure that caregivers who are working with ADHD children are using the methods where and when they need to use them when the child is under their care. I've already mentioned routine exercise. I won't repeat myself about that. It's quite valuable as a way of coping with ADHD. About 40% of ADHD children have sleep problems, so finding ways to improve their sleep can improve their daytime attention span and therefore make their ADHD a little better. So children with sleep problems should be evaluated by their doctors for whatever intervention they might need to address that problem. Here are the various parent training programs that are available in North America. Other countries may or may not have these programs or might have some similar to them or based upon them, but going under different names. So there's a lot of different programs out there for parent training. They're all very similar. They all teach similar skills. They all have similar results. So, I'm not going to say that one is any better than the other. You'll see that my program at the top, Defiant Children, is the one, of course, that I developed and that I use. But these other programs do very similar things at what they teach parents to do. And the things they do, you see here. All of these programs are teaching parents to reduce their level of conflict and emotion, to be more consistent, more quick, more immediate, to increase their level of attention and praise for good behavior, and to rebuild a positive relationship with the child, while also improving the way they reward children for complying with requests and tasks and demands, including using not just praise, but also tokens, points, sometimes food or snacks, electronic privileges, and so on. Whatever rewards the child, that's what we're going to teach parents to use to back up a child's behavior when they behave, to reinforce it. And then, of course, teaching parents not to talk so much, not to repeat their commands, not to delay the consequence for the child's behavior, because that just weakens the effectiveness of the consequences and the commands. So we teach parents to back up what they ask with a consequence, either positive or negative, depending on what the child has done, of course, and to do that within 10 seconds of the child doing what was expected or refusing to do what's expected, and then you act very quickly. And of course, if the child refuses to do what they ask, we don't allow them to do other things until they have complied with the request. So I've talked about the effectiveness of parent training declining with age as we get to adolescence. No need to review that. I've mentioned that these programs differ very little both in what they teach, but also in their effectiveness. So they're all pretty good. Use whatever ones you're able to get your hands on. They mainly work on oppositional behavior more than on ADHD behavior, but that's good because most ADHD children have trouble with stubbornness, defiance, noncompliance, and so on. And then, of course, providing information about ADHD and related disorders and providing professional support to the families also improves behavior. Just knowledge is power. Knowledge is helpful for families when they come to understand what ADHD really is. Now, I did mention that psychological treatments do produce side effects, and you will see many of them listed on this slide. Time doesn't permit me to go through each and every one of them, but please have a look at these, because about 10 to 15%, as many sometimes as 20 to 25% in families with teenagers, do experience some increase in distress, in conflict with their child or teen, within their own family or their own marriage. Sometimes in younger children, we might see an increase in anxiety. Some people report an increase in certain kinds of traumatic episodes that they re-experience if they were traumatized. That's especially true when we are trying to use mindfulness meditation as a psychosocial treatment with people with ADHD. Sometimes we see an increase in aggression, where when you try to set limits and place demands on a child and be very consistent in doing so, the child reacts negatively and may become more hostile, more defiant, more aggressive. And that's a side effect in some families. And of course, we sometimes see that some families simply don't benefit. They're not effective in helping those families with that particular child. So for these and other reasons, clinicians need to monitor their patients when they do psychological treatment, ask specifically about whether any adverse effects are occurring as a result of what we're teaching you to do with this child, both at home and at school. There are side effects at school too. So we need to be more vigilant, be more systematic, more direct in asking families about the adverse effects of what we're trying to train this child to do, because sometimes they do happen. There are a few experimental programs I'll just notice or take note of here. These are not yet evidence-based. We need more research on them to support them as truly effective treatment. There's a very promising program for social skills training called Friendship Coaching being developed at the University of British Columbia by Dr. Mikami. And hopefully that program will be available soon in treatment manuals that people can purchase. It's a very good program. The reason I like it is because generally social skills programs, the way they're traditionally done, do not help ADHD children. So we don't recommend them. But Dr. Mikami has redesigned social skills programs based on the executive function theory of ADHD, and she is getting some very good, promising results with that. There's an after-school program available in some cities in the United States called Challenging Horizons. It's for teenagers. It's done at the high school, after school, for a couple of hours each week. Teens come together as a group who have ADHD, and they work with paraprofessionals or other school staff who are going to tutor them, meet with the teachers and give them advice on school management, spend a few sessions with parents giving them advice on home behavior modification and management, teaching social and sports skills, and so on. So it's a nice little package that goes on several hours each week after school. And the reason it's done at the school is so that teens don't have to leave school to go get treatment, and they're more likely to comply and participate when you make it easier for them and less stigmatizing for them to do so. There's some evidence that we can do some organization and time management training with teenagers with ADHD to help them with their homework, with their schoolwork, to be better organized, to use their time better. And we work with their parents and teachers to learn these same skills. Dr. Joshua Langberg here at my university, Virginia Commonwealth University, has developed a manual that's been tested several times. It's getting very good results. It's available for purchase, called the POSS system for organization training. So it's very good at helping teens with their homework and schoolwork. There's been a little bit of interest in developing curriculums for preschool children who might go on to develop ADHD or other executive problems. These initial pilot studies did show some promising results, but that's all they were. They were very small studies. They did not involve clinically diagnosed ADHD children. They did not go on and follow the children. So there's a lot of work that needs to be done before we can say that we've got a good curriculum for helping preschoolers with ADHD in school. Some people are getting some very promising results with mindfulness meditation, more with adults with ADHD, to some extent with teenagers, not so much with children. Although a couple of studies did claim positive effects, others are not finding it to be so good with kids. So in the future, we might see mindfulness and meditation training helping people with ADHD to better manage not just their symptoms, but also especially their distress and their emotion regulation problems. So watch for that. Some studies have tried transcranial magnetic stimulation, which is sending a strong magnetic field into certain regions of the brain using a small transmitter, and that changes the functioning of that brain tissue. And to date, we have not seen any good positive results in rigorous studies. Most studies find no effect or mixed effects from these, and most of the research is very poor. So at this point, this treatment that originally was used for depression doesn't seem to help people with ADHD too much. There was one study out of Los Angeles using a method called trigeminal nerve stimulation. It's a device where the child wears a headband while they sleep. The headband emits a very low electrical current into the brain. This is believed to stimulate the trigeminal nerve and the networks that it's connected to in the brain, and it's believed that that would help improve the functioning of the ADHD brain regions that might be connected up with this particular nerve. One good study, pilot study, found that after weeks, I believe it was 12 to 14 weeks of using this, they did find improvement over a placebo where the children were using the device, but it wasn't sending the signal into the brain. So it was a very good study, but it is only one study, and it needs to be replicated. Right now, this treatment is only available in the U.S. by prescription from a physician, and it has to be done under a doctor's care. I have not heard that it's available anywhere else in other countries as yet. There's one pilot study out of England that is looking at using magnetic resonance imaging, functional imaging, of imaging the brain and particular centers in the brain as to how active they are using fMRI, and then feeding that signal back using a video game to help teens learn how to increase activity in the brain through improving their performance in the game. They did get positive results from this biofeedback study, but I want to emphasize this is fMRI biofeedback, not the commonly available EEG biofeedback, which is not effective for ADHD. This treatment is not available. As I said, it's a small pilot study. Maybe it will be available in the future. We have done a number of experiments in our country looking at the omega-3 and 3,6 fatty acids delivered in fish oil capsules. Originally, companies who manufacture this claimed that it benefited ADHD. The subsequent studies by other people, particularly that were rigorously done, did not find that to be the case. Fewer than 25% of the children improved, was mainly in attention, if that. And as a result, we do not recommend omega fatty acids for management of ADHD. Finally, we'll conclude with this list of treatments not to do, because either we studied them and they don't work, or we're not going to study them because they just don't make any sense, like chiropractic skull manipulation has no basis in science or theory as to why that would help improve ADHD by massaging the skull. We've tried removal of sugar and other additives from the diet. That has not been very successful. Sugar does not increase ADHD, so removing it doesn't do much good, at least for behavior anyway. We've tried various substances being added into the diet, like megavitamins or antioxidants, like the drug pycnogenol, or adding minerals and supplements, and we've not found this to be very effective. Now, some children are deficient in certain vitamins, particularly vitamin D. When it comes to ADHD, those children need to have vitamin D supplements or iron supplements, because some children with ADHD are low in iron, and maybe that might help them a little bit with their ADHD, but it's not a cause of their ADHD, and therefore improving it isn't going to help that much. And also, most children with ADHD don't have these vitamin or mineral deficiencies, and therefore adding more of them into their diet isn't going to make any difference. There's exercises that occupational therapists do, sensory integration training. That has not done well for ADHD children. We don't recommend it. I've obviously dealt with chiropractors already. Play therapy and psychotherapy are not helpful for ADHD, even if they're helpful for other conditions like depression or anxiety. Teaching children to control their own behavior has not been successful in our studies with ADHD. This is often called cognitive behavioral therapy, and we've not had good success with it. I've already mentioned social skills training. When it's done in the standard treatment forms, it is of no benefit for ADHD at this point. And then, as I've said, EEG biofeedback, often called neurofeedback, has been studied extensively now in the US and in Europe. And most recently, a large number of big studies, well done, rigorous procedures, using a placebo, a form of sham biofeedback, making sure that parents and teachers were blind to who got the real treatment and who didn't get it. When that kind of research is done, uniformly, it shows no benefit of neurofeedback beyond the placebo effect. So it's mostly placebo. There's a lot of interest in developing games, apps for smartphones and tablets that people can play and practice and maybe improve certain brain functions. To date, there is no evidence that these games are able to do so. Now, mind you, despite there being only 300 or so games and apps out there that might be recommended for improving ADHD symptoms, there's only one study and that study was a treatment failure. So at this point, despite the excitement about using technology, it's not all that useful at this point for ADHD children. So I hope you've seen that the best treatment for ADHD is a combination of medication with science-based psychological therapies, parent training, school management, accommodations in both places, as well as counseling of families and teaching them about ADHD. Put it all together, that's a very good treatment program for people with ADHD. We've seen new discoveries in delivery systems for stimulants. We've seen some new medications over the last 20 years, like Strattera, like the antihypertensive drugs that might be helpful. We're beginning to see people trying to develop newer psychological treatments, particularly social skills training and organization and time management training for teenagers, so that might be helpful. But in general, we have to face the fact that we are dealing with a chronic condition in most children, but one that we could manage very effectively with the available science-based treatments. We can safely say that ADHD is a highly treatable disorder, one of the most treatable psychiatric disorders that we deal with in terms of the amount of treatments we have, the diversity, the impact of those treatments, what percentage of people respond. It's all good. So despite this being a chronic condition, it is manageable, often manageable quite successfully. The biggest problems we still face, at least in my country, is getting access to all of these treatments for most families living in most communities, trying to keep the cost of them down, and then getting patients to stay in treatment and comply with treatment. Thank you very much for paying attention and watching this lecture. I hope you found it informative. Have a good day.